So welcome back to another episode of PT Meal, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of physical therapy profession and practice. Once again, I'm Johan De La Paz, your host. Welcome to the podcast. So in today's episode, we are going to talk to a professional that we sure encounter in our practice as physical therapists. They help our patients with their braces, their splints, and their replacement limbs. So I'm talking about an orthotist and prosthetist. So my guest today is a certified prosthetist and orthotist in the Philippines and co-founder of ALBM Prosthetics and Orthotics. She is Milani Purugganan. Tama ba? Did
Yes,
I
sir.
pronounce it
Tama.
correct?
Yes.
All right. Lenny, welcome to the podcast.
Thank you. Thank you for having me, sir.
Hi. Hi. So you're the first non-physical therapist that I interviewed because I wanted to also have professionals in the or different disciplines that we as physical therapists work with. Kasi marami naman tayong mga nakakasalamuhan mga professionals in
Mm.
terms of our patients and clients. So yeah, so you're the first non-physical
The
therapist
first. Wow. Ang
in the
sarap naman
show.
pakinggan.
So before we begin, could you talk to us a bit about yourself?
Alright.
What do you do?
Yun nga. So,
Mm-hmm.
I am one of the pioneers to be a certified prosthetist and orthotist, or CPO to be in short, in the Philippines.
Mm-hmm.
Accredited by the International Society of Prosthetics and Orthotics, or the ISPO.
Mm-hmm.
And I am also a co-founder of ALBM nga, Amputee Limb and Brace Maker, Prosthetics and Orthotics, which specializes in custom-made prostheses or artificial limbs for amputees and body external devices for people with special needs such as, but not limited to, to spinal scoliosis,
Mm-hmm.
cerebral palsy, poliomyelitis, and more. So that's what I do for a living. Yun talaga yung ginagawa ko as a CPO here in the Philippines.
Nice, nice. And you mentioned that you're part of the pioneering
Mm,
of sa CPO.
yes.
So talk to us about that. Paano ano ibig sabihin nun that you are part of the pioneer
Alright.
batch?
Actually, parang pang fourth, I think third batch na kasi akong graduate
Mhm.
actually, no?
Mhm.
So, very limited yung number ng students nung time ko. Like, in a batch, 10 lang yung graduates, ganyan.
Mhm.
Minimum of
Wow.
5, maximum of 10. So, parang first of 30 graduates ng CPOs.
Mhm.
And, nakuha ko yung course ng ano pa lang siya. I think the year it started almost ganun, 2010. So, parang kakagraduate ko talaga ng high school.
Mhm.
Tapos, eto na agad yung naging course ko. So, kumbaga ba talagang kami yung unang-unang sumabak dun sa curriculum nung
Mhm.
pagdating niya dito sa Philippines.
Mhm.
So, ngayon, as of now, yun na yung ginagawa ko talaga. Nagtuloy-tuloy ako as a CPO. So, parang, ngayon medyo marami na rin. May mga
Mhm.
sumunod na rin. So,
Aha.
during my time talagang, wala pa. Kahit nung pagka-graduate ko, bilang na bilang din kami na nagtuloy as a CPO. So,
Mhm.
ngayon, medyo marami na. So, very happy about that.
Mhm. So you're talking about the program in
Mm.
UE, tama ba?
UERM,
UERM.
ISPO, yes.
Mhm.
University of the East, Ramon Magsaysay, Philippine School of Prosthetics and Orthotics.
Nice, nice, nice. And how many years to itong ano na to,
Okay.
course na
Sige,
to?
during nung time
Ah.
ko, it was a 5-year course with one
Wow, wow.
year postgraduate internship. Nung time ko yun.
Uh-huh.
But now, dahil sa K-12, parang naging 4-year course na lang siya.
Nice. And
So,
may
nabawasan
board
ng
exam
2.
din kayo?
Wala kaming board exam here in the Philippines,
Ah.
pero we have international certification exam. Yun nga yung
Mhm.
hinahandled by the ISPO, the
Uh-huh.
International Society of Prosthetics and Orthotics.
Nice, nice.
Mm-mm.
So, I just wanted to know yung ano yung reason bakit mo napili yung ano or pagiging orthotist and prosthetist?
actually no apparent reason kung bakit ko siya napili.
Uh-huh.
The usual na after mong graduate ng high school, parang ako, I want to take up med, gano'n. So I'm gonna
Mhm.
look for a good pre-med. Then,
Mhm.
ang naisip ko is PT that time. So, yun
Mhm.
talaga yung nasa isip ko. So, wala lang, hanap lang ng good PT school and na-come up ko yung UERM.
Mhm.
So, pumunta talaga ako sa UERM thinking na I'm gonna enroll as a PT, ganyan.
Uh-huh.
Nag-entrance exam ako as a PT. But then, na-offer yung course, ganyan. Tapos sabi nila, this is the first in the Philippines, being so young at that time. Sabi ko,
Mhm.
wow, first in the Philippines. Sige nga, I will take
Mhm.
it up. So, dun lang nag-start kung bakit ko siya kinuha. Walang apparent reason, parang it just sounds so appealing na it is the first in the Philippines, no? But I think the most important thing is why I stayed as a CPO, na pwede naman akong, continue yung gusto ko before na to go med.
It.
Oo, yun. So I think the most important part is nung nakahandle na talaga ako ng patient during the internship years, na dahan-dahan mo marirealize yung meaning na it is first in the Philippines talaga. Kasi nung nag-internship ako, nagkakaroon kami ng patient na lumilipad pa talaga sila. They travel a lot, malayo, just to be, just to be seen, na makita yung child nila or
Mhm.
sila,
Mhm.
because wala talaga silang makitang institution who offers this kind of field, no?
Mhm.
So, parang dun ko siya unang na-appreciate
Mhm.
actually. And
Right.
then, it follows lang na nagkaroon ako ng first patient, I think stroke patient pa siya, hindi ko siya makakalimutan because first patient ko siya. Tapos, parang sabi niya, wala, hindi na kasi ako makapasok ng work kasi nahihirapan ako maglakad, ganyan. Tapos, ako naman, I was just doing it by the book, I have to do this, I have to do that, kasi this is how I should do it. The usual
Mhm.
thing na gagawin ng student. And then after that, nung natapos ko na lahat ng gagawin ko for her, talagang sabi niya, thank you very much. Kasi it's easier for me na maglakad outside, bumalik yung confidence ko. Na-realize ko that time that I was able to help her physically, not only physically but also mentally.
Mhm.
So, I think doon talaga pumasok yung bakit ako nag-CPO.
Mhm.
Kasi parang you analyze and then papasok mo yung emotion mo. It is very fulfilling. So,
Mhm.
yun. Kung bakit ako hanggang ngayon CPO talaga.
Mhm. Same, same. Ah, tayo na
Oo.
nagtatrabaho sa rehab, 'pag nakita natin yung mga
Yes.
pasyente nating, yung
Oo.
mga ganyang mga stories that like sabihin
Mm-mm.
sa'tin na, "Oh, you helped me with this, na
Mm.
gumaan yung pakiramdam ko,
Mm-mm.
nakapag-function ako ng mas mabuti,
Mm-mm.
nakakagaan talaga ng pakiramdam."
Yes.
Mhm. So, very, very talagang very limited lang talaga ang mga orthotists and prosthetists before the program. I think
Mm.
nung mga before yung actual program ng BS ng UE
Mm-mm.
UERM, may mga pumupunta lang dito na orthotist prosthetist then trains people who wanted to do that. So kaya
Yes.
kaya
Yes.
maganda
Yes,
yung
that's right.
na-establish na yung first program talaga sa Philippines by UER. Kasi
Yes.
sobrang laki ng need.
Yes. Yes.
Mhm.
Yes.
Right. So,
Yes. Mm-mm.
describe to us, kindly elaborate a little bit on what an orthosis and prosthesis is. Para doon sa mga nakikinig na
Alright.
probably not
Sige.
familiar on the terms.
Sige. Orthosis and prosthesis kasi plays a different roles talaga, no? So
Mhm.
siguro I'll start with prosthesis muna. Actually, a prosthesis is a custom-made device made to replace a missing body part,
Mhm.
no? So it can be because of, na-amputate ka because of trauma or
Mhm.
accident or any other medical condition, or meron kang congenital deformity na kailangan mo ng something to replace a body part. May it be legs, may it be arms, even fingers. Yeah.
Right.
So that is a prosthesis.
Mhm.
Next naman, ang orthosis, ito yung mga externally device na ina-apply, made to support or control, for example, if you have muscle weakness, any joint or bone deformity, to assist you, to help you na um, magawa yung daily activities mo and future presentation. So, to help you function more. Yeah, ganun
Mm-hmm.
siya.
So,
Orthosis.
orthosis is to aid, and
Yes.
prosthesis is to replace a limb.
Replace.
Mm-hmm.
Yes.
Yeah, so, para mas madaling matandaan ng ating mga
Mm-mm.
audience. Pero yun nga, sa tingin mo, you mentioned earlier about the story of your first patient, kung bakit ka
Mm-mm.
nagstay,
Mm-mm.
and why you're still a CPO.
CPO, yes.
Ano naman yung other qualities that you think you have na makes you, made you stay in that career?
Qualities ko?
Mhm. Mhm.
Alright. Actually, napaisip ako dun na ano bang qualities ko that made me stay. Siguro kasi,
Or
um,
qualities that make you enjoy doing what you're doing right now.
alright.
Mhm.
Ngayon kasi, after I graduated, hindi ko naman sinasabing nagsispecialize ako for pedia na
Mhm.
orthosis. Alright, hindi ko naman sinasabing ganun. Pero that's what I enjoy the
Mhm.
most. Siguro it helped a lot na yun talaga yung parang lumaki ako sa big family with a lot
Mhm.
of kids. So naiintindihan ko kung gaano dapat kasigla yung isang bata, isang baby. So pag nakakakita ako ng someone na I know na at this age dapat ganito na yung ginagawa niya but wasn't
Mhm.
able to because of medical condition. So parang yun yung quality ko na parang gustong-gusto ko siyang gawan or basta pag nakita lang ako sa labas na pwede siyang magganitong device kahit na nakikita ko lang siya lumalakad sometimes sa church, sa mall. So I think yun yung pinaka-quality na ngayon ko lang naisip because of your question na yun pala, kaya pala gustong-gusto ko ng pediatric
Mhm.
orthosis.
Mhm.
So I think
Nakaka-
yun talaga.
Nakakatuwa naman yung question, yung sagot mo na yan. Yeah, when you see a child
Parang
walking,
automatic
may
po pasok sa isip ko na ganito yung gait niya. I think magiging benefit pag ganito. Yung parang
oo.
gano'n, na it
Oo.
comes na usual na lang. Hindi na
Oo.
siya yung pag-iisipan mo. Parang
Oo.
gano'n.
Nakakatawa kasi ganun din kami mga PT. Pag
Oo.
nakakita ko may mga
Ay,
naglalakad, nag-a-analyze na kami agad ng
oo.
gawin. Kayo naman,
Diba? Kaya,
naisip nyo na agad ano yung device na pwede niyang gamitin.
Ang pwede niyang
Nakakatawa.
gamitin. Tapos,
Mm.
syempre, di ba, para ikaw, you keep it to yourself, pero hopefully, makita pa siya ulit. So, pag nakakita ka ng other child na lumapit sa yung ganito, ay, ganito yung nakita ko. So, parang alam ko na paano siya i-handle. Yung mga ganun.
Nice, nice. Nung sa PT school, meron kaming a course or a subject na orthosis and prosthesis. So,
Mm-mm.
ang lab namin doon, kumuha kami ng AFO tsaka ng resting hand splint.
Mm-mm.
Sobrang, for me, nung gumagawa kami, parang naisip ko, parang hindi ata para sa akin. No? Kasi,
Mm.
kailangan meticulous ka eh. Kailangan
Yes,
mabilis yung kamay
physical
mo.
work. Physical, yes.
Oh. Aside from
Oo.
being creative, kailangan meticulous ka sa mga measurements.
Yes,
Mabilis
that's
ka sa
right.
pag-ano. Ganun ka rin ba?
Mm-mm.
Very, meticulous, very organized,
Yes,
very
kasi
fast
talagang
worker.
Um, nandun na tayo sa fast worker kasi talagang pag gumawa ka ng device, kailangan yung time mo very limited. Kasi lalo na pag bata, di ba? So,
Mhm.
you have a growing child, hindi pwedeng, next month na lang. Hindi siya pwedeng ganun. So,
Aha.
when you get his measurement, when you hand-casted that patient, kailangan talagang sunod ka sa time mo. Meron ka talagang sinusunod na time. So, nandun yung working fast at the same time. Hindi naman sa perfect, but, dapat kontento ka na, okay, I did what I have to do na. Then, that is
Mhm.
enough. Ganun. Yes.
Mhm. Nakakatuwa.
Parang nga kaming mga ano din eh, pwede mo din sabihin para kang artist kasi nagmo-mold ka talaga, iniisip mo yung form, netong bone na to, paano ba siya, yung, kunyari, yung mga arc ng foot, yung mga
Mhm.
ganyan, iniisip mo.
Mhm.
Eh,
True.
syempre, every child, every person, iba-iba, di ba? So, you get to see different, so hindi lang siya yung one cast, eto na para sa lahat. Yeah.
Mhm. Tama.
Mm-mm.
Nung doon sa class na yon na tinuro namin ng orthopros for us,
Mm-hmm.
pinlay namin yung parang video ng introduction ng UE about
Oh,
their
really?
bachelor. Kasi
Wow.
it was new by that time eh. Bagong-bago lang
Oo.
siya. Kaya
Mm-mm.
syempre inintroduce namin sa mga students na
Mm.
meron ng course dito sa Philippines on
Oh,
orthosis and prosthesis. So nakakatawa. Tapos
yeah.
nakikita namin doon sa video, pinakita nga yung sa pag-create ng mold, ang ganyan. Sabi ko,
Mm-mm. Mm-mm.
sa sarili ko lang, pero parang sabi ko, ang daming kailangan gawin if you're doing a
Yes.
prosthesis, ang daming
Yes.
measurements, kailangan very
Yes.
exact. Tapos,
Mm-mm.
you go in and adjust, go in and adjust.
Mm-mm.
Very ano rin siya. Hindi siya yung parang pag nagawa
Very
mo na yung isang
intricate.
bagay, tapos na,
Yes.
kailangan binabalikan din. Nakakatawa.
Yes. I
So,
think yung talagang problem with custom-made devices, hindi mo talaga siya mape-perfect ng isahang gawa, you know. Hindi naman sa hindi mo siya mape-perfect ng isahang gawa, but dapat alam mo kung saan manggagaling yung problem and you know how to fix it. Kaya I think yun talaga yung pinaka-benefit ng that's why you're making it as a custom-made for each patient.
Right. So, take us to what is your process when you meet your patient or your client for the first time? Anong nangyayari dun sa buong session?
Well, very important is doctor's referral. Doon
Mhm.
talaga papasok yun. That's the very first step. Dapat each patient meron silang doctor's referral. And then after the doctor's referral, doon pa lang talaga kami papasok for the assessment. Actually, the assessment, hindi lang siya yung assess ko yung muscle strength, assess ko yung joint motion. Most definitely, dapat nakalatag na din yung treatment plan mo. Your treatment plan, either bago mo siya bigyan ng device and after mo siyang bigyan ng device. Kasi lagi ko itong sinasabi sa bawat patient ko na pag binigyan ko naman kayo ng device, it's not like magic na you would be able to function well with the device. You'll be able to maximize the device well, di ba? So, kailangan nandun na yung treatment plan. No? Kaya nga yung sinasabi ko kanina na when you made a custom-made device, dapat alam mo kung saan manggagaling yung problem, alam mo kung ano yung kailangan mong gawin before mo siya bigyan ng device. So, kasama lahat sa assessment yun. So, parang nandun na yung sino kayang mga other professionals ang pwede kong tawagin to help me do this kind of job. Yan, no? And then, pag nalatag mo na yun, dun pa lang talaga kami magsa-start ng casting. Dun pa lang talaga papasok yung, okay, let's start with your making the device. Yan. Dun pa lang siya papasok. Ngayon kasi in the Philippines, ang gamit talaga naming method is hand casting pa din. Yan. So, by the hand casting, talagang kunin mo yung mold ng patient, either the legs, the arms, ganyan. And then, after the casting, doon na papasok yung hard work. Doon na papasok yung physical work na gagawin mo yung device. You do the modification. You'll get help from your technicians to do the fabrication. And then, after mo magawa lahat yun, doon mo palang pwede i-fit yung device. So, you'll see the patient again, fit mo yung device, check out procedures, and then balik sa check-up, sa regular follow-ups. So, sa regular follow-ups, dapat naka-ready na agad na, okay, you have to be on a session program with PT ng ganitong sessions, and then balik kayo sa amin pag may nakita si PT na kailangan i-adjust. And then pag fulfilled na si PT, fulfilled na si PO side, balik sila sa doctor nila for the final check-out. Ganon. Ganon ang procedure. Haba, no?
Haba. How long does it usually take from your initial assessment measurement to the actual or final device fitting?
Usually, ang talagang time is 1 week to 2 weeks. Lalo na if you're working with, kasi syempre, hindi mo masabi yung time na baka in a week, biglang mag-change ng weight. In a month, lumaki yung bata. So, as much as possible, we try to finish our work at least 1 week, 2 weeks maximum. Or sometimes, kapag hindi talaga kayang-kaya because of the, limited resources, yung mga materials na kailangan mo pang i-outsource outside. So, usually, maabot pa rin ng 1 month, pero as much as possible, hindi dapat.
Wow. You mentioned fitting kids. Syempre, di ba, kids really grow, may mga growth spurts pa. Gaano kadalas sila nagpapalit ng mga ng devices?
Siguro based on my experience lang po with orthoses or yung mga externally applied devices. Usually talaga ang parang nagiging baseline namin is around 8 months to 1 year nagpapalit sila. Especially for the foot and ankle length, yung mga foot length, mga height, yun nagkalaban, lalo na pag growing kid talaga. Usually 8 months to 1 year.
Hindi naman pwede yung external device. Lakihan na lang natin kasi lalaki yung bata.
Oo,
Kasi
hindi naman
kailangan
kasi,
natin.
oo, di ba? So, yun yung actually, isa pa yung mahirap na bakit kailangan ganun kabilis magpalit? Tapos makikita ng parents na, okay, kaya pala ganun kasi nandito, hindi na siya ma-adjust. Yung parang ganun.
Mhm.
Yeah.
Oo nga. So, how do you deal with parents like with that? Yung mga maraming tanong. How
Mm.
do you deal with that?
Talagang before ako sa assessment pa lang, before
Mhm.
ako mag-proceed sa casting, talagang yun nga, sabi ko sa'yo, latag na talaga lahat.
Mhm.
So, dapat nandun na yung kailangan tanungin mo yung goal ng mother. Kasi
Mhm.
syempre, di ba, usually, hindi mo naman matatanong yung bata. So, kailangan matanong mo yung goal ng mother and then yung expectations niya.
Mhm.
Kasi we have to set okay po we have to set our short-term goal. For the short-term goal, within the next 3 months, ganito yung pwede nating makita. Alright?
Mhm.
Pwedeng medyo may mas makita pa tayo, pero pwedeng hindi. Yan. So
Mhm.
talagang, I think the very important part is setting out a goal and talagang discuss yung expectations. And I think talagang very helpful yung experience pag ganun. Na
Mhm.
kasi syempre, di ba, sometimes pag by the book, dapat ganitong month, nakakatayo na yan,
Aha.
nakakalakad na yan, But syempre, hindi naman always ganun. So I
Aha.
think the very important part with dealing with parents is setting out their goal and yung expectations.
Right. How do you deal
Mm.
with the patient or their parents non-compliant in wearing their external devices?
Non-compliant.
May mga ganun ka bang patient
Yes, may
or
mga ganun kaming
experience?
way before, nung bago pa lang talaga akong nag-start na maging independent CPO,
Mhm.
na-experience ko na yan, na kasi ayaw talaga ng anak ko
Oo nga
iiyak
eh.
siya,
Oo.
yan, nandun talaga yan, nandun, hindi mo siya maiiwasan.
Mhm.
Kaya ang nangyari ngayon, very important, dun ko na appreciate yung wearing schedule.
Mhm.
Nag-come up kami ng wearing schedule kasi, di ba, usually, for example, for spinal scoliosis brace, usually dapat suot yan, like 23
3
hours a
hours.
day.
Mhm.
Yes, di
Mhm.
ba? So, very hard, lalo na pag bata pa talaga yung patient mo. So, I think doon pinakapapasok yun di ba? Kasi hanggang pagtulog. So, ang ginawa talaga namin is, nag-set kami ng goal na dahan-dahan, on the first week, ganito mo lang isusuot, and then
Mhm.
on the second week, you will increase, para dahan-dahan din nasasanay yung bata. And then parang during the fitting nung device, aanahin mo na rin siya na, kaya mo ba? Kasi kung hindi mo kaya, pwede nating i-adjust. Yung parang assurance sa kanya na, pag hindi ko pala kaya, may tutulong sa akin. So I think that's
Mhm.
also very important, So
Mhm.
other than the wearing schedule, you assure your patient and the mother na if talagang nakita namin na hindi naman pa kaya, we can really assure them na, okay, we can do a different type of treatment, parang different type of wearing schedule lang.
Mhm.
Hanap tayo ng ibang treatment plan. Parang
Mhm.
ganun.
If you encounter problems like that, um, do you also try to offer options, kunwari, a different type of device na pwedeng gamitin, or you stick to what you think is best for the patient?
Ah, oo. So, actually, nangyari na siya multiple times na parang
Mhm.
sasabihin sa akin, na-search ko sa internet. Pwede namang gabi lang suotin.
Mhm.
Ganyan, di ba? Yung mga ganun. Bakit
Ah.
hindi pwede? So,
Aha.
pagka ganun, usually, syempre, maaano pa rin na kung ano yung gusto ng parent, sometimes kailangan mo rin siyang sundin. Kasi
Mhm.
hindi mo pwedeng ipilit yung gusto mo.
Mhm.
But kapag ka ganon, kini-clear ko and nililay-out ko talaga yung intentions ko na, okay, this is the pros kapag ito yung gagamitin niyang device. And
Mhm.
the cons is uncomfortable.
Mhm.
So, pag ginamit niya ng gabi, the pros is comfortable and the cons is hindi natin makukuha yung kailangan nating correction or support. And I always say na, for patients na growing kid, hindi naman sila forever na naka-external device. So,
Mhm.
bakit hindi natin habulin yung time na kailangan lang nilang mag-device and then afterwards, kasi usually, di ba, you give external device para as hindi makapag-surgery, di ba?
Mhm.
So, parang you lay out all the information, ganun ginagawa ko, lay out all the information, I know, and then at the end of the day, so what do you think, mommy?
Mhm.
Should we push through with this or not? Kasi hindi ko pa na-try na ipilit yung gusto ko na, hindi, wala kayo dyan. Hindi, wala pa naman. Talagang actually tiyagaan sa explanation lang.
Mhm. With matching ano ba, with matching audiovisual
Oo.
presentation.
Yes, oo. Sa article na ganito.
Ito yung ipapakita ko sa inyo yung ito susuotin niyang ganyan.
Oo, yes.
Okay. So, is the bulk of your clients mostly pediatrics or marami ka ring mga clients in like geriatric or adults?
Ano sila, hati, actually
Mhm.
hati. Pero most definitely, mas marami lang talaga ang pediatric
Mhm.
patient.
Right.
Dahil parang kapag usually sometimes pag adult, they learn other ways to cope up no?
Mhm.
Na
Mhm.
parang rather than kapag ka talagang ayaw nila, it's fine.
Mhm.
Parang they learn other ways like, pwede naman ako mag-rehab and all that. You
Mhm.
lay out that, other treatment plan.
Mhm.
Pero for pediatric kasi parang it's better to start early. So
Mhm.
parang mas marami rin talaga akong na-handle na pedia patients.
Mhm. Tsaka mas marami talaga needs for
Mm-mm.
pedia. Sabi mo nga hinahabol mo nga yung ano nila, yung
Mm-mm.
growth nila.
You help as much as you could. And then after that, syempre, tapos na. Meron tayong limited time.
Mhm. So aside from, uncompliant patients or parents, again, what are other sabihin natin challenges that you experience in that line of work?
Siguro nung nagsisimula pa lang ako, I think the hardest part is letting people know that we exist. Yun yung
Mhm.
pinakamahirap na part.
Mhm.
Kasi usually, ang nangyayari is pagkatapos ng doctor's referral, di ba parang yung patient, minsan sila lang maghahanap kung saan sila pwedeng makakuha ng intervention.
Mhm.
So, there are times, nagkaroon na rin ako ng clients na not satisfied with the work nung
Mhm.
mga previous na napunta nila. So, I think that's one of the challenges na na-encounter ko is letting people know that we exist. And eventually now naman, we're growing, tsaka very happy dahil meron na kaming directory
Mhm.
ng kung saan lang yung mga certified POs. So, madali na siyang
Mm.
hanapin, yes. And
That's good.
yes, and I think consistency ng intervention. Kasi not to
Mhm.
mention, we live in a third world country, syempre,
Mhm.
di ba? So, we had to adjust yung costing ng materials mo, costing ng services mo. Hindi ko siya
Mhm.
pwedeng hindi ipasok kasi, that's what I do for a living. So, I think yun yung challenges talaga, yun yung two major roles na
Mhm.
ipaalam mo that this service is offered by Certified Prosthetist and Orthotist and at the same time make your service available. Not just
Mhm.
available na marireach ka nila but yung kaya nilang i-sustain.
Mhm. Have you encountered a patient or a client that requested this type of prosthesis or this type of orthosis kasi
Mm-mm.
nakita nila somewhere, kasi
Yes,
nakita nila,
yes,
para sabi na,
yes.
ay, cool yung ganun. Pwede ba akong magkaroon
Mm-mm.
ng ganun? Gusto lang multi-jointed na na
Yes.
ankle.
Syempre. Nagkaroon tayo ng mga ganon. So,
Mhm.
pagka ganon, tapos hindi naman pwede sa kanila. Kasi
Mhm.
on your assessment na hindi naman pwede sa kanila. Sometimes you don't directly say na, ay, hindi mo kasi pwede sa inyo yan eh. Kasi makaka-break ka na, ay, sa parang, ay, ganon,
Mhm.
mapapansin mo. So, you have to think of them, yung feelings nila. Kasi syempre, with disability, parang you have to be careful with what you say kasi
Mhm.
talagang nagsistuck sa mind nila yun. So, dahan-dahan na, what if eto na lang po yung ibigay natin sa inyo kasi ganito yung presentation nyo.
Mhm.
And then, eventually, if we see some improvement na pwede na kayo sa device na yan, maybe
Mhm.
in the next years, tignan natin kung pwede. Kasi ako, I never close the book na, ay, hindi ka pwede dyan. Baka
Mhm.
kasi, ayan. I never close the book kasi you
Mhm.
never know kung anong magiging improvement ng patient na yon in the next year.
Right.
So for now, ito lang muna. And then eventually, pag nakita ulit tayo and they see na pwede na, why not? Diba?
Mhm.
Ganun. Yes.
Have you handled para-athletes?
Um, Wala pa kaming na-handle na para-athletes, but
Mhm.
nakaka-handle na kami nung patient na high activity sila. Like
Mhm.
yung talagang before silang ma-amputate, nagba-biking sila, bowling sila. So yes,
Aha.
naka-handle naman na kami.
So you also, try to meet their functional needs. Talagang hinahabol mo
Yes.
yung ano nila, kung ano yung
Mm.
devices na for them.
Yes, yes,
Mm.
yes, 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 yes.
Wow.
And at the same time, syempre, you work with their budget and then you think na kung ano yung pwede nilang magamit ng
Mhm.
function-wise is good, diba? And
Mhm.
at the same time, mag-iiwan ka rin ng idea na if ever this is the best na device for you, so pero ganito ang price niyan, ganyan,
Mhm.
ganon. So you just lay out yung, kumbaga ba yung long-term goal mo na pagkaya, then let's
Mhm.
do it kasi this will be better. Yan,
Mhm.
mga ganon.
Are the materials available in the Philippines, or do you import them?
We
Yeah.
import and there are materials na locally available as
Mhm.
well. But mostly ang mga pang prosthesis namin or yung mga pang artificial limb namin is
Mhm.
in-import talaga namin.
Mhm.
Yes.
Nice.
Mm.
Okay. Na-amaze ako sa mga ganun talaga, whenever I see yung mga improvements on the
Mm.
devices now, na ang dami
Mm.
ng dynamic mechanisms
Yes,
for
yes, yes. Never ending siya actually. So,
Oo.
kailangan sabay ka din. Oo,
Oo.
kasi, yes.
Very dynamic din ang profession
Mm-mm.
nyo. Nakakatuwa.
Mm-mm. Mm-mm.
So, do you see that yung mga devices would have, robots, or ano na,
Okay.
mechanized na siya,
I think yes, kasi ngayon talagang sa mga amputees, meron na yung mga microprocessor na
Uh-huh.
computerized na, di ba? So
Right.
yes, oo. So yun yung mga kailangang i-absorb pa namin para
Uh-huh.
ma-improve talaga here in the Philippines.
Yung may mga
Kasi sa
EMG
ibang bansa,
sensors.
yes, sa ibang bansa parang ang layo na, di ba? Dala.
Mhm. Mhm.
Mm-mm.
Nice, nice. Um what's your an experience that you will not forget sa practice mo? It can be a good one, or it can be a bad
Mm-mm.
one. I'm sure we can learn something from it.
Talagang experience na hindi ko makakalimutan
Mhm.
is siguro college years, yung first time kasi sa UER and PSPO, they teach us from the very beginning. Yung,
Mhm.
yung dirty work, yung physical work, yung pagod and all na, ako babae ako, I use, mga machines, I use mga power tools, mga
Mhm.
ganyan. And then, parang nung time na yun, bakit ko ba ginagawa to? Bakit ba ako nandito? Yung mga ganyan. Kasi hindi ka pa pwedeng mag-handle ng patient hanggat
Mhm.
hindi mo kayang gawin by yourself lahat ng process. Ganun ang nangyayari sa
Oh,
program
okay.
namin. So, I think it's very nice kasi ngayon na, nagsarili na ako, na parang I work around it, na parang dun mo ma-appreciate na kaya pala ako tinuruan kasi I'm gonna use it in the future talaga na, and I
Mhm.
can share knowledge din, di ba? So,
Mhm.
I think yun yung most unforgettable ko na yung I'm asking myself, bakit ko ba ginagawa to? And then, super big turnaround nung nakita ko na yung effect. Yeah.
Mhm. Before going to your bachelor's, hindi ka ba mahilig magkumpuni,
No,
gumamit ng
no,
mga
no.
tools?
Oo, wala, wala,
Talaga.
wala. Talagang babaeng-babae, ganyan.
So
Tapos
nasabak ka
pagdating,
talaga.
nasabak, kaya that's why I'm asking myself, ano ba itong ginagawa ko? Nagpupukpok ako ng martilyo, mga ganyan. So,
Uh-huh.
but eventually ngayon, parang it's the, parang normal thing na ginagawa ko siya.
Uh-huh.
So, ayun, kaya very big turnaround, pero unforgettable actually.
Mhm.
Mm-mm.
Nice, nice. And do you do the devices yourself, or you have a team with you that help
Ah,
you?
now kasi, ang mga CPO kasi usually ang ginagawa talaga namin is assessment,
Uh-huh.
designing the device,
Mhm.
prescribing the device, and then yung cast modification. The
Okay.
cast modification kasi, and casting and cast modification. The cast modification kasi very crucial yon kasi doon ka mag apply ng mga corrections, kung ano
Mhm.
magiging final form ng
Right.
gagawin mong device. And then after that, may team kami na ipapasa namin sa mga technicians. So,
Okay.
technician, sila na hindi na ako masyado nagpupukpok ngayon. Yan. Sila na yung naggaganon for us. So,
Mhm.
ngayon, sila na yung mga mag-aano ng plastic, magkakat, yung mga
Mhm.
ganyan. And then, after nilang matapos yung final, after naming ma-check, kami ulit ang mag-fit. So,
Mhm.
ganun siya. So, actually, it's a team eh. So, kasi nga, you have a very limited time, ang
Mhm.
dami-dami mong gagawin. So, you will need help along the way talaga.
Right, right. Nice. So parang ano pa rin, no? you have your own rehab team din sa aspect ninyo, no?
Oo,
Uh,
parang gano'n, yes.
mm, okay. If someone wants to get into that career to be a certified prosthetist and orthotist, ano yung mga qualities or traits that they need to possess para they can survive and thrive in that career?
Oh, of course, syempre una is your patience.
Mm-hmm.
Kasi nga, talagang dapat tiyaga.
Mm-hmm.
It's it's very tiring mentally kasi you're studying, ano? And then at
Mm-hmm.
the same time, very exhausting physically.
Mm-hmm.
Talagang dalawa. And then, so talagang tiyaga. And I think, ang pinaka masasabi ko lang is always think na yung patient nyo, you treat them as your family, as if you're making the device for a family member. Para talagang matyaga mo siya kasi hindi mo lang isipin na sige na nga, kailangan ko kasing gawin to. Yan. Actually,
Mm-hmm.
that line is nanggaling sa professor namin nung nag-aaral kami. Siguro nakikita na niya yung pagod and everything. So, sabi niya, the quality para talagang ma-surpass mo yung stage na to is think of it as if you're doing this for a
Mm-hmm.
family member. Kasi diba, if you're doing this for a family member, iba yung energy mo,
Mm-hmm.
iba yung perfectionism mo, talagang lahat gagawin mo. So, I
Mm-hmm.
think that's the best advice anyone gave me. Kaya, yun din yung binibigay ko always.
Nice. And for physical therapists, because the audience of this podcast is physical therapists, ano naman yung message mo for physical therapists that would work with you or work with their own team of or orthotist and
Orthosis
prosthetist.
and prosthetics. Nako, very,
Nagugulol ako lagi sa
oo,
ganun.
oo. Kasi nakakano for is, pero
Uh,
very important talaga ang mga physical therapists sa amin. As in, they play a major role talaga for us na PO.
mhm,
Kasi, for example na lang ha, kasi I cannot explain kung gaano sila ka-important. For example, I'm just gonna put it in an example na if we have an amputee patient na bago pa lang siyang amputee, you know,
mhm,
there are times na syempre kailangan mo silang makondisyon bago silang mag-device. Kasi
mhm,
hindi easy eh. You know, as what I've said, it's not like magic na pag binigyan kita ng prosthesis, you're gonna walk.
mhm,
It's not something like that. So, kailangan mo siyang mag-train. So, talagang pag nagkaroon kami ng PT na who's, you know, same goal as ours. Actually, we have team of PT na talagang ganun, na talagang into helping, into service, na
mhm,
ang galing, napapalakas talaga nila yung patient and then nabibigyan namin ng device. And then, sila yung nakakapag-maximize ng device na yun for the patient. Na
mhm.
for example, may device na, ay, hindi kasi ito pwede pang stairs. Pero magugulat ka, matitrain ni PT na nakaka-up and down ng stairs. You know,
Ah,
so it's never a closed book talaga. So,
mhm,
very important ang mga PT sa amin because they help us na ma-attain yung goal na siniset namin for the device that we make.
mhm,
So, hopefully, marami pa kaming PT makitang ganun.
mhm.
Yes.
Nice,
Mm.
very collaborative talaga yung
Yes,
relationship
oo.
ng
Mm.
ng PO na lang. Hindi
PO
ako
na lang,
bulol.
para hindi
Di
natin lol.
PO na
Kasi ako
tsaka
nga PT
POPT.
lang eh.
So yeah, na-experience ko din yan eh with sa Philippines tsaka dito na when I have a patient na that new amputee,
Mm-mm.
minsan yun nga eh kailangan makondisyon namin yung physical nila then their mental
Yes.
to really
Yes.
be ready
Yes.
for
For
the
the
device.
intervention, yes.
Mm.
Mm-mm.
Kasi minsan sila kasi parang meron pang may sense of denial pa,
Yes.
meron pa sabihin nila baka hindi nila kaya or para
Mm-mm.
saan pa, yung
Oo.
mga ganun.
Tsaka takot ako eh, baka pag hinakbang ko, biglang hindi pala kaya, yan, yung mga
Exactly.
ganon.
Aha.
Diba? So,
Mhm.
how can you assure the patient na kaya niya? So,
Mhm.
dun
So,
papasok.
yung collaborative and same message from you guys, the POs and us PTs, that this would help the patient na at least they
Mm-mm.
would
Yes.
realize that nandun tayo for them to
Mm-mm.
help
Yes,
them.
yes, yes,
Nice,
yes,
nice.
yes.
So, ang dami ko natutunan and I gained greater appreciation to what you guys do.
Thank
Um,
you.
I just thought before that you would come to like measurements and stuff, but there's
Mm.
a lot of work that is involved in what you do,
Yes.
and yeah, sobrang appreciate ko yung mga ginagawa niyo as POs.
Oh, thank you so much.
Mhm. And thank you for being in the show and sharing your experience with us. And if our audience, physical therapists, would like to get in touch with you for your services, kung may mga pasyentes lang kailangan ng devices or prostheses, where can they reach you?
Actually, they can reach us sa page kasi doon kami very responsive
Mm-hmm.
sa ALBM Prosthetics and Orthotics, actually sa Facebook page. We also have our Instagram account at albm.ph.
Mm-hmm.
And then siguro pag napunta naman sila sa Facebook page namin, makikita nila yung clinic number. So,
Mm-hmm.
ako din naman ang sasagot doon.
Wow. Ikaw
Yes.
din yung sumasagot sa
Ako
mga
din yung
message.
sumasagot doon. Yes.
Nice.
Oo,
Very, very
automatic.
hands-on ka talaga.
Yes.
All right. So again, thank you. But before I let you go, I have my last three bites for sa question sa ating conversation. So my first question is what is for sure marami ka nang nakakausap about your career, about your profession. What is something that you want people to ask you na hindi nila natatanong na that you feel that it's important for you to share?
That I feel it's important for me to share
Mm-hmm.
is from a patient or hindi, from my colleague.
Any pwedeng
Mm,
something that the patient should ask you pero hindi din natatanong or a colleague that should ask you pero hindi din natatanong?
oh, I think siguro is how do you um, how do you maintain your work na lang, yung quality
Mhm.
of work.
Mhm.
And yun na lang siguro. Kasi, sometimes there are patients as well na, of course, syempre, there are days na you're making a custom-made device. It's not
Mhm.
gonna be the perfect one. There
Mhm.
are days.
Mhm.
So, sometimes makakarinig ka ng criticism about it. But, for me kasi is yung quality ng work ko, it's more about the function rather than the appearance. So, if
Mhm.
ever someone also asked me as a PO na colleague ko, na pag may nagtanong usually sa amin how do you maintain your quality of work? So, usually, because of the appearance, ang mga
Mhm.
naisasagot.
Mhm.
But, I think ang walang nag-ask sa akin is, ano yung baseline mo as you give a quality device? Yeah,
Mm.
quality siya for you.
Mhm.
So, I think answering ko na rin para
Yeah,
hindi na
go.
nila
Yeah.
itanong. So, I think yun nga, I think quality for me of the device that I'm making is the function na nakukuha ng clients, ng patients.
Mhm.
So, regardless of the appearance, but of course, I still care about the appearance. Kaya talagang naghaharap kami ng ways to make the devices cute for the patient
Mhm.
na mga child.
Mhm.
But in perspective, it should always be the function
Mhm.
na gusto mong ma-achieve.
Mhm.
Yun.
Ang ganda nun Ang ganda ng sagot. Maganda yung question, ang ganda ng sagot. Kasi a lot of people might, focus more on the aesthetics
Yes.
ng
Kasi syempre, di ba,
device.
parang sabi nga nila, yung devices para na siyang para siyang yung art na pwede mong isuot. Ganun
Mhm.
siya. So,
Mhm.
parang ganun na yung lumalabas ngayon sa work namin. Yun na din yung hinahabol namin actually.
Mhm.
But, so, sometimes people think na the quality of the device depends on that.
Mhm.
So, parang pag may nakikita na, bakit yung kanya ganito itsura, yung akin ganito itsura.
Mhm.
So,
Mhm.
it serves a different purpose.
Mhm.
Diba? So, I
Right.
think yun.
So you measure quality of the device by its function and
Yes.
how it helps you. Nice,
Yes.
that's good. My second question is, what is something that you have read, you have watched, or you have listened to that again is something worth sharing?
Which I think that's the most na lang in relation to my field yung
Mm-hmm.
advice from my professor talaga
Mm-hmm.
na you treat every patient as if they are your family
Mm-hmm.
para talagang you give your best in every work that you do. Yeah.
Nice, nice. All right. My third question is the show is named PT Meal. It's a complete meal of insights, experiences, and stories. So, what are the three ingredients that make it can be a quality, a trait, your motto, your principle. What are the three ingredients that make up Danny?
Me?
Mm-hmm.
Oh, akala ko in my profession. Mm, Me, I think compassion.
Mm-hmm.
I'm very compassionate about in what I do. I am very, I mean, mahilig akong mag-analyze eh.
Mm-hmm.
Analytical person as well.
Mm-hmm.
And I think um, emotional as well.
Mm-hmm.
Yeah, so I think that's the thing, ano, to explain me.
Mm-hmm.
Yan. Mm.
All right. Being compassionate, analytical, and emotional. That's very important then it's a career eh.
Yes.
Kaya I think bagay na bagay ka because really being compassionate with your patients, trying to,
Mm.
do your analysis in your
Yes.
in the devices that you're gonna present and being, emotional and supporting the patient. That's
Supporting. Yes.
very important. Okay. Nice. Again, thank you very much for
Thank
being
you.
the show and sharing to us what you do, ano yung, what does it take to be a PO, and
Mm.
how we as physical therapists and POs work together to help the patient. So if there's something that you want the audience to take away from this episode, this conversation, one thing that you want them to carry with them, what would it be?
Oh, okay. So, siguro sa mga other professionals, I think my takeaway is I'm very hoping na there would be other professional who's watching this na na-explain ko mabuti what the PO is, kung anong ginagawa namin, and how we can work together. And then for other people naman, like for a patient or a client who will be needing our services, I hope na pinpoint nila na, where they should take their services. If it's not from me, just be careful in choosing where you will papagawa ka ng device.
Mhm.
Yeah.
Oh, in that note, kasi parang may patanong ako dun sa sinabi mong yun eh.
Yes.
Are there people that claim to be is that a problem in the Philippines that people would claim to be a certified PO? May mga marami
Ah,
bang ganon?
Actually, I think wala naman yung word na they are claiming to
Uh-huh.
be a certified
Mhm.
prosthetist orthotist. Ano. There are people kasi here in the Philippines na, before pa ma-establish tong course, they are
Mhm.
doing it na. Yun yung
Mhm.
mga nasabi mga kanina na
Oh.
there are, expats na pupunta dito and then
Mhm.
teach people for a certain time or a training to do a
Mhm.
specific device.
Mhm.
So, hindi mo na kasi maaalis yun, hindi mo na
Mhm.
matatanggal yun. They've been
Mhm.
in the industry for, I think, 10 years or more, di ba?
Mhm.
So, there are people na gumagawa ng device,
Mhm.
but um, not in the level of ISPO and WHO standard. So, I think
Mhm.
it's very important kasi syempre hindi naman gagawin ng ISPO and WHO ang standard na yon to
Mhm.
ensure the quality of services ng prosthetics and orthotics in the Philippines. Actually, not in the Philippines lang, in other countries as well.
Right.
So, yun lang naman.
Mhm. Gotcha. Right. So make sure that kung saan kayo nagpapagawa would be a certified
Yes.
PO.
Yes.
All right.
Yes. Someone who can help you talaga.
Okay. All right.
Yeah.
Thank you again, Lani, for your time and
Thank
for
you.
sharing.